Hi everyone, this is Megan here with ICE Magazine. We're so excited to be here again on the second day of AHRA. We're about to get started here in the exhibit hall, but first I wanted to catch up with my friends here at KA Imaging. I'm going to go ahead and let Kareem introduce himself and tell you all a little bit about KA.
Perfect. Hi everyone, my name is Kareem. I'm the founder and chief technical officer for KA Imaging. Very excited to be here.
Yeah, we're excited to have you. So also I know I'm going off a little of the rails here, but Kareem has also done a couple of our ICE webinars before, so you might be familiar with them already. But today we're going to talk a little bit about, I want you to tell me a little bit about the spectral DR.
Okay.
To tell our audience.
Yeah, for sure. Spectral DR is really dual energy 2.0. So you've heard of dual energy. It's a technique by which you take an X-ray, but you get 3 images instead of 1. You get a regular DR image, you get a soft tissue image and a bone image. Well, older generation dual energy had some challenges. You needed to take 2 exposures, you had motion artifact, and you had to work with fixed systems. Spectral DR is a new technology that has overcome all that. You can get no motion artifact, single exposure, low dose, and it's mobile and portable. So it's really the next generation of X-ray. And anybody who has an X-ray today can use a spectral DR detector because it'll give them the X-ray, plus it'll give them the dual energy images without changing the source, without changing your technique, without changing the radiation dose.
So going a little bit more further in that, can you tell us a little bit about the approaches of the dual energy subtraction?
Absolutely. So older generation dual energy, and dual energy has been around for 40 years. The older generation dual energy, they use 2 exposures. Either they change the KVP of the beam, so they used a low kV and a high kV, or they used a filter to do switching between different energies. And really and that's what the challenge was. 2 exposures means twice the radiation, you're limited to a fixed system, you have to use a grid, you can't get away from it. It's not portable. But with spectral DR, you get a single exposure, you can use the grid if you like, no motion artifact, and it's portable. And that's what makes it different.
So how is this going to be beneficial to those imaging departments?
Oh, it's a huge benefit to imaging departments. Imaging departments are trying to improve their quality, they're trying to reduce their costs. How do you do that? Early detection, better quality imaging. So spectral DR or dual energy can allow you to go into the portable scenarios like in the ICU. You don't have to move your patients around the hospital for CT because you get a good image at the bedside. You can avoid falls, you can avoid extra radiation to the patient or to the clinician or to the technician, right? So there's lots of benefits there.
And one more question for you. Is it clinically proven yet?
Absolutely. We have so many clinical studies. We've got clinical studies for pneumothorax. We've got clinical studies for pneumonia. We've got clinical studies, a very recent one that's going to be presented at the RSNA. We're looking at the use of our spectral DR, the improvements it can provide in a non-radiology setting. So for example, somebody in the ICU who has to read an image on a regular monitor, can they get benefit from that? And the short answer is yes, you can.
Perfect. Now, I know everybody's dying to know where they can get some more information. So where should they find you? Where should they go to get this information?
Right. So the best place is our website, www.kaimaging.com. And of course, you can always reach out to me directly.
Kareem, thank you so much for being with us here today. We're so excited that we had a chance to talk with you. Everyone, if you are here at AHRA 2022, make sure to come check out booth number 208, KA Imaging. Kareem will tell you all about what we just spoke about today, and we will be on, I believe, tomorrow again, so make sure to catch up on updates here on ICE Magazine Social. We'll see you soon.